The following interviews are patients of mine who didn't want to be identified, and so I'm going to be speaking with them over speakerphone, and we're going to be speaking about a variety of topics, so I hope you enjoy it. Well, hello.
Hey.
How are you doing? Thank you for coming on. I appreciate it.
I'm good. How are you?
Good. So, if you could tell us, what brought you to first see me, and what led up to that.
Okay. So my daughter has had anxiety for since 2021, and really just, oh gosh, I'm so nervous. My husband found you by listening to Dr. Peter McCullough.
Right.
So, yes. So he called you, made the appointment, and that's how we found you.
Yeah, Dr. McCullough, Peter McCullough is pretty well known, kind of famous because he is one of the lead doctors when it came to the COVID and exposing the problems with the pandemic and the vaccines. And so he and I are very like-minded about the disaster of what happened with all that. And I've been on his podcast twice, talking about my books. And we've also, like I said, we're very like-minded. And so great guy. And like I said, he's really like a hero of what he's done to help people and expose the truth about what really happened and some of the problems that are the lies that are continuing to happen too. But anyway, I can keep going on that subject all day. So,
and I think that's how my husband, he agrees with you guys.
Yeah. Right.
We both do.
Right.
And he's been listening to the doctor, and so because my daughter had been struggling, and we had tried counseling for her, it didn't really work. We tried some medicine before, and it wasn't great. And
which medication did you try before?
We tried Lexapro.
Right.
Because I had been through a bout of anxiety about 2017. Mm-hmm. I tried it. For me, it was like a light switch. As soon as I took it, I felt normal again. Mm-hmm. I didn't stay on it, and then it was it was good. I was through that, and so I just thought, okay, that's going to work for my daughter. She's good, it's going to be great, and that's not what happened for her. And so, and I don't love drugs. I don't love medicine or the thought of staying on it long term. And so I didn't want to do that to her. And so when my husband heard the podcast, he liked, what you said. I think because you evaluate your patients, it's not just like give them something and then, go on your merry way. It's like you have a visit and then you have another visit, and how is it doing now? And do we need to up it? And also, I think maybe you mentioned, I never actually went back and listened to the podcast, but maybe you mentioned you don't put somebody on it just to stay on it forever. It's not that, permanent fix. And so, anyway, he loved all that. He told me about you, and I was like, well, this doctor sounds great. Where is he? He said, well, he's in California. And I'm like, well, that doesn't work for us because we're in Alabama. And I thought that was the end of it. And so my husband contacted your office and said, hey, do you guys do televisits? And sure enough, you did. And so we made an appointment for you to talk with me and my daughter. And yeah.
And if I just reviewing when I first saw you, I think because it's only been actually 3 visits we've had. But with your daughter, with the anxiety, she also had a choking episode where it really scared her. And then she had problem with fear of swallowing food for a little while there too, right?
Yes. And yes, exactly. So I think it was last November, we were eating steak and she choked. It got stuck, not to where we had to go to the hospital because she could breathe, but just that feeling.
Right.
And so that added, to the anxiety as well. Then there became an eating anxiety, and she's small and does not need to not eat.
Right.
So that was yeah.
And then also, you decided to homeschool her for the year too. What led to that?
So when anxiety started, she would have been going into the 7th grade. And right before that, COVID had happened. So her 6th grade year, where she would be starting middle school, I kept my kids home because I didn't want them to have to wear masks every day. I didn't want them to have to come home because they sat near somebody that was, tested positive for COVID. And I just thought that's just such a disruption. Like, I'd rather be consistent and just be at home.
Yeah.
And so, so for her first year of middle school, she was at home. So then she starts middle school in the 7th grade. And I think that was tough as it is. And, their hormones and just all the things that go on with that. And so, so after her 7th grade year, it was a tough year. She said, I'm done with public school. And I was like, well, okay, we'll try a co-op. And so she would be home, a few days a week, and then in school at a co-op a couple of days a week. And that was okay, much better than being in public school at the time. But now she's going into the 10th grade this year. And she's going back to public school. She's excited and ready to go back. And she's on a trip right now to the beach with one of her friends. She's been gone since Monday. She doesn't come back until Sunday. And this is the longest she's been away since 2021.
Wow.
I mean, and that's like a miracle. This time last year, that would not have been the case at all.
Well, when I heard what happened with Lexapro, which is, with the fact that you did well with it, that's a good place to start. It's not unusual. That's not a criticism of the doctor, because that's a reasonable one to start with. But didn't work out. So I had a feeling that Prestique would work. So I gave you Prestique the first visit. And by the second visit, you said that she was about 50 to 75% better. Yeah. And at the first visit also, I think she had headaches and neck and shoulder tension and shortness of breath at times. So she was having a lot of the anxiety and some of the physical symptoms associated with the anxiety, which is common. And then I think that visit, I said, okay, let's double the dose from 50 milligram to 100 milligram, which I do a lot. And then the last time she said she was significantly better, back to her old self again, right?
Oh, yeah. Yeah.
Yeah.
Yeah.
And that's the point. That's the point here, is that with her, that wasn't the real her. And again, with having it start at 11, or a lot of times these things start around puberty. It's and even a little bit before puberty, but a lot of times late elementary school into middle school is a very, very common time that we see anxiety and depression starting. We got a mixture of genetics. There's some genetics, from you, and I'm not sure about your husband's side. There's hormone changes of puberty, and then there's stress that's going on I think you said she had some bullying going on at one point. So there's a combination of things that were contributing there. And so throwing off her chemicals. So all I'm doing with the Prestique, and she's on just the one thing, is reestablishing those connections, and that's why she's kind of back to herself again, and now able to do the things she used to do without fear. So, but I really enjoy someone like her. I love your daughter. She's just so sweet, and just to see her life restored, it just gives me so much pleasure when I see that, and especially how.
Yeah, it really is. It's just. My husband and I have talked about, we are so thankful. I think it was a God thing that he just happened to be, listening and found you, because we were kind of like, what do we do now? We were just, I don't know. I hate to say I don't trust doctors, but, sometimes I feel like they just kind of push medicine on people, and it's just kind of like, this is it. This is what, like the Lexapro or whatever. Here, take, and it'll be better. And so I don't know. Maybe that's not the way it is, but you know.
Well, no, it is. I think a lot of doctors aren't great communicators, and not to down doctors too much, but a lot of doctors just don't know what to do. If you don't respond to an SSRI, a lot of doctors really don't know where to go from there. That's like, well, that's all I do, and then something as simple as Prestique, which I've been prescribing for 20 years. They don't understand the difference between Lexapro and Prestique, and so so that's why I mean. There's so many people like your daughter who will never ever get better because they'll never, they'll never see a doctor who knows what to do. And again, I push drugs too, but when I push a drug, I like I explained to you the first visit. This is not an addictive substance. This is not something that's going to cause her harm. This is something that's going to restore her balance and restore her person. And then so it's just really a matter of also explaining to people what a medication's about, and not just here, just take this pill. Doctors have to take the time to explain and to understand, get people to understand this is why you're taking this. Now, how long will she take it for? It's not really clear. You were on something for a year and you went off it, you were fine. So I think, once we get her through puberty, maybe going into the next year or so, then we can consider trying to go off and see how she does, to see if her system is kind of rebalanced on its own at that point yet. But we don't really know for sure yet. But it's not a big deal right now because it's not a harmful product. It's very safe and very effective. And so, but I love when I see results like this because it's why I do what I do. Is to see this kind of thing happen.
Yeah. Yeah, I'm sure it's very rewarding. It has been for us, that's for sure.
Great. Well, thank you so much for coming on. I really appreciate it.
Yeah, thank you for having me.
We'll talk to you soon.
Okay.
All right. So in her case, she was on an SSRI, right? She was on Lexapro, didn't like it, tired, so that was, a medication that works on serotonin. So we call it selective serotonin reuptake inhibitor, and didn't work out well, but she didn't like it. So, which is common. Put her on Prestique, and the only thing Prestique does different is it adds the serotonin and norepinephrine, and that's it. That's all it took with her, and and then she's about 13, 14 years old. And I got her up to 100 milligrams, which is the maximum dose, but it doesn't matter. A lot of people think, oh, she's so young that she's going to need to be on a really low dose. It doesn't really matter. It really comes down to what's the right dose for the person. It's not so much about, you have to keep this dose because of this age or this whatever. It's not about that. It's about finding the right medication for the individual. Well, hello, welcome.
Hi there.
How are you doing?
Doing good.
Good. So if you could share with us, kind of go back to the beginning when you first saw me, how long, I don't know, how long have I known you? Long time. Long time. So tell us, kind of go back when you first started seeing me and kind of walk us forward from there.
Sure. So I was diagnosed with depression when I was 28. And it was a couple of years in there where I was being treated by different doctors, but wasn't making any progress. And my wife had actually gone to a marriage counselor who said, well, there's nothing to resolve in your marriage until he gets treated for depression. And he actually gave us your name. So that's how we got first connected. And you were the first person to figure out that I wasn't dealing strictly with depression, but that I had bipolar.
Right.
And that began the process. And from the beginning, it became pretty obvious that I was bipolar as you began to treat me. Everything seemed to make sense then.
Yeah, and it's, do you remember, I'm trying to remember details back then. Did you present with any type of mania or
Yeah, I typically ran on the manic side.
Right.
Until I hit that point of exhaustion and then I'd crash really hard.
Right. Yeah, that's what.
So I used to love it because I was always on the creative and in the manic phase, getting a lot of stuff done, but I would pay for it in the end.
Yeah, and with and you're an extremely creative person and very intelligent, and so that's very common actually with people with bipolar disorder is the intelligence and the creativity. And that's why I think a lot of people say, yeah, I like that part of it. I like either the mania, or we call the hypomania, when the mind is racing and the creativity and the thoughts are flowing and everything is great, and then not getting much sleep because you can't shut your brain down. And then that leads to, eventually, and it doesn't last, and eventually you crash into depression. Do you remember as far as the medication? 'Cause I know what you're on now, but do you remember which medications we did each step of the way?
Not specifically, but I remember when I first went to a physician and she prescribed me Zoloft for depression. And then they tried Prozac, and they tried a couple of other things. And then when you and I got together, you immediately put me on Cymbalta, which was the first medication that actually treated the depression. Mm-hmm. And then through the years, Cymbalta was the mainstay. And I think we had tried some other mood stabilizers, but ultimately came up with Lamictal. Mm-hmm. And those two really balanced each other out. And then now we've added Vraylar to the mix. And, for the bulk of the treatment that I've been through, I haven't had any manic phases since you and I started seeing each other. Mm-hmm. That's been very well under control. But I always felt like I was just slightly underwater.
Right.
And sometimes I'd break through and I'd have not really a manic phase, but more of I get maybe just mild mania. Right. And that, led back to the creativity. And that was something that I was like, oh, I really like this feeling. I want this. So when we added Vraylar to the mix, I kind of evened out. And now I'm right in that middle sweet spot and have been for a long time.
And then tell me about when the ADD started getting treated.
So didn't realize I had ADD till we treated the bipolar.
Right.
Looking back now through my school years, I can recognize my behavior of both ADD and bipolar. I remember distinct episodes as a kid and even through high school manifesting those particular items. But once we treated the bipolar, the ADD became, I would just continually spin. I felt like, and it wasn't depression, it wasn't mania, but I wasn't able to focus on my work. It would take me 3 hours to get something done that should have taken me 20 minutes. And so we've started out with Adderall, and that's actually been really, really good for me.
And it didn't make it. And see, when you treat bipolar and you adequately stabilize the mood, then a person can handle an ADD medication. I just spoke with a woman just a little bit ago about this same issue, that it really kind of helped to calm her brain down, and that's what happens. I think but you have to just treat all these things correctly. You have to have the right balance in order for that to happen. Because if one little piece is off, it throws everything off.
Yeah, and I would say that the treating the ADD really affects my mood. So if I miss taking Adderall, I could see that reflected in my mood after a couple of days. So it not only does it help me focus, but it definitely influences my overall mood. Right.
Excellent. Well, it's this is bipolar disorder is it's a fascinating subject to me. I really like it because I like the complexity of it. It's simple. It's not as simple to treat as just regular depression or anxiety. I enjoy treating all of it, but I think with this condition in particular, I like it because I like to see the results as with you. And I like the fun. To me, the fun is learning how to combine medications together and realizing that it's not about the number of medications you're on; it's about the results, and it's about the fact that if we don't get the pieces in correctly, or if the dose is off, the results are not going to be complete. And then sometimes if things go off a little bit, well, we need to relook at it, and maybe adjust something. But I think in your case, you've been pretty stable for quite a while now, and so.
Yeah, I've been real stable for the last 20 years. I think one of the big additions we made to my med group was the addition of Saffris for sleep.
Right.
Even though we were treating the bipolar, I still suffered from that lack of REM sleep, it felt like.
Right.
And when we added the Saffris to it, now I get a full 8 hours of rest, and when I wake up in the morning, I'm not fatigued. Mm-hmm. I have a pretty regular routine, and I sleep really, really well.
Right. And, did you get this condition from your mom or your dad or both?
This just came from my mom's side.
Yeah. And
I remember distinctly when I was a child that she had a bipolar break, and she was hospitalized. Mm-hmm.
Yeah. So and that's why you can't help it. We can't help our genetics. It is what it is, and So, but the important thing is that we get rid of all the stigma, because I think when people hear the word bipolar disorder, that people think, oh my gosh, I don't have that, do I? But yeah, it's a condition like every other medical condition out there. It's treatable, and the best thing to do is not worry about the stigma, not worry about that. Just seek the treatment. And I think so many people have this condition to never treat it correctly, and unfortunately, they live their lives suffering with something that they don't need to be suffering with, and it also causes a lot of disruption in life. It causes disruption in marriages and relationships with your friends and with your family. People can lose their work from it. So it can really lead to a lot of problems in life if someone doesn't really face up to it, and thankfully you have, and I'm just it's like I said, it's just been such a pleasure to work with you over the years, and your family too. I've seen some members of your family also.
Yeah, and I just met a young man 2 days ago who confided in me that he was bipolar and that he was struggling with medication, that he wasn't having any success with his current doctor, and I made a referral to you. You'll be hearing from him.
Oh, good.
Because we spent about an hour talking about our experiences with bipolar, and I think he, in his case, was not being treated properly.
Unfortunately, that's way too common. But yeah, I'm looking forward to seeing him, and thanks for the referral. And yeah, I like it because, like I said, there's a complexity to it. But I think I've been doing it for so long. You get a feel for it, and when to put each medication in, because I only do one medication at a time, and so I have to figure out what goes first, what goes second, what goes third. Because when you're bipolar, you got to be at least 3 or 4 medications, probably a little bit more. So it's not as simple as mild depression or mild anxiety, because there's other layers to it. So, but anyway,
yeah, and I've noticed through the years, as I have really tried to focus on the medications and the effect they have on me and any potential side effects. So I've experimented with adding or taking away as you have instructed. We've removed something and then seen how that has manifested. And I would say that the mix of the combination of medicines that I'm currently on, that I've been on for the last 15 years, have been super, super stable without any side effects.
Excellent. Well, I really appreciate your coming on and helping me to explain all this. And you're, like I said, you've been a pleasure to work with. You're not only a patient, but you're also my friend. So
I appreciate that. You're a friend as well, and I couldn't have done this without you. Life was a mess. It was pretty terrible before we met, and I owe you a great deal of gratitude.
Well, thanks for sticking with it, and thanks for coming on the show. I really appreciate it.
Absolutely.
Okay, talk soon. Yeah, so in his case, again, with bipolar disorder, you got to really look at the big picture. And extremely common that serotonin, norepinephrine, dopamine, GABA, they're all involved, not unusual. So he had tried, Zoloft, I think, or Lexapro, SSRI, which, it helped a little bit, but not a lot. I put him on Cymbalta, SNRI, so basically serotonin, norepinephrine, that was better. A little bit of Wellbutrin, that's what I do a lot. The dynamic duo, put a little bit of Wellbutrin in there, that's good. But in his case, like a lot of people, like every patient with bipolar disorder, it's not enough. So what else? Lamictal, again, extremely important antidepressant with bipolar disorder, works on GABA. The only antidepressant that balances GABA out there. And also, what else? Well, again, as the case with him, which is dopamine is probably the most key chemical with bipolar disorder. So Vraylar is, we call, again, a dopamine antagonist. So it slows down dopamine. Wellbutrin gets it going, because if we don't have the Wellbutrin, he'll be tired, won't have motivation. But if we only do the Wellbutrin and don't control the dopamine, then it'll increase his potential for mania and throw him off balance. So the Vraylar slows down dopamine, kind of gets that perfect balance of dopamine is what we want. And sorry for the messiness, by the way, here, but that's kind of the way I draw. I'm not an artist. And then Saffris is one. It's an older medication, but it's a really good one. So basically, he's on Vraylar and Saffris, both antipsychotic medications. We call them atypical antipsychotic medications. But a lot of my patients, I put two together. So the Vraylar is not helping the sleep, but the Saffris does. So that Saffris helps at night to slow his brain down, get him into a REM sleep pattern like he's in now. And then with him, as well as another person I spoke about recently with bipolar disorder, is they're on a stimulant. They're on an ADD medication. Now, most doctors aren't going to get this, okay? Most doctors don't understand how to treat this correctly anyway to begin with. But most doctors are going to think you can't put someone on a stimulant. It's going to make them manic. It's going to make them worse. Not when they're stabilized. So like in his case, when I stabilize his mood, then you can tell the focus isn't there. So when we put in Adderall or Concerta, it just gets things moving better. Because sometimes what we do is if we just slow things down, it's not going to help the focus. So, but when you treat ADD with a stimulant, the way you know it's being treated correctly is it actually calms the brain down. It actually it helps to, because with ADD, the brain is all over the place. It's scattered like squirrel and this, and, it can't get down and focus. So when I do it carefully, obviously, and I do it slowly, but in a lot of cases, there's ADD and bipolar disorder. And again, most doctors aren't going to understand how to treat both of them together, or they're afraid of doing it, and they shouldn't be. But if they learn how to do it, then you can have great success. If you don't treat the ADD, then they're going to have problems at work, problems with relationships even, because when you can't focus, it doesn't help your life at all. But yeah, his is a really good case of just putting things together, getting all four of these chemicals properly, getting everything moving in the right direction, and his result is a really excellent result. So. I hope you enjoyed the show today. If you have issues with mental health, or if you know someone who needs help, I'm available. If you want to contact my office, my website is drpaulcoronamd.com. That's DR for doctor. And you can also learn more about me on my website. My phone number, if you want to contact my office directly, is 949-481-0118. If you want to learn more about my methods and what I do, my latest book, I recommend The Corona Protocol, a scientifically proven medical solution to stop addiction, bullying, homelessness, school shootings, and suicide, 30 years in the making. In this book, I tell 30 original short stories about people. And I also have my first 3 books, Healing the Mind and Body, the trilogy, available online. I look forward to you joining me again on the next episode of The Dr. Paul Show.